guys preparing?
Preparing to launch. This seems daunting today.
Ooh.
We're live.
Okay. All right. Hello, everyone. I forgot the little gavel. I don't know where it is. There it is. Thank you, ma'am. We are officially calling the meeting of Board of Health to order. It is Monday, December 15th. We will do a quick roll call to start off. Would you like to lead us off?
Sure. Tiffany Jane, board member.
Lindsay Rickmeyer, board chair.
JJ Connor, board member.
Okay, thank you. To start off, are there any public comments on items under the board's jurisdiction but not on the agenda? No public comments? Any public comment? Okay. We have minutes to approve.
This is Tiffany. I motion to approve the minutes from September 15th.
Okay, I'll second that. All right, there's been a motion by Tiffany to approve the minutes from September 15th and seconded by Lindsay Rickmeyer. Is there any public comment? Is there any public comment? Okay, hearing none. All those in favor, please signify by saying aye. Aye. All those opposed, same sign. Motion passes. The minutes are approved. Hi, Doc. Thanks for coming.
You're welcome. Hello.
How are you?
I'm reasonable, thank you.
Good. All right, so we will start off with the board member letters of interest and recommendations to the commission. Daleen, you're so good about getting all these packets together, and then I mix everything up with my stuff. Let's look at that. I was going to start with the resignations. I think we can read through each of these. We have 3 resignations, and we can read through these and accept all 3 resignations in one motion.
Sounds good.
And it is our habit to read through the letters just so it's on record. All right. First letter of resignation is from Emily Clark at Billings Clinic. She said, "Dear Broadwater County Board of Health, I'm writing to formally resign my position as a member of the Board of Health effective 12/31/2025. This decision was not made lightly, as I have greatly valued the opportunity to contribute to the health and well-being of our community. However, due to a change in my role at work and personal commitments, I believe it is best to step down at this time. I am committed to ensuring a smooth transition and will gladly assist in any way possible during this period. Please let me know how I can help facilitate the process. Thank you for the support you've given me during my time on the board. It's been an honor to serve alongside you all." Again, that's from Emily Clark. The next letter is from JJ Connor. JJ, do you want to read your own letter? Seems like it would be.
Sure.
Yeah. Okay. Thank you.
To Broadwater County Board of Health, I'm submitting my resignation from the Board of Health when my term expires on December 31st, 2025. I found my time with the Board of Health to be very valuable and great experience. However, my current job conflicts with many of the Board of Health meetings, and I found it difficult to adjust my work schedule. I believe I have provided what input to the Board of Health that I could, and it's now time to step aside, thereby allowing a more qualified person with new ideas and more specific work-related experience to become a member of the Broadwater County Board of Health. I truly appreciate my time on the Board of Health and the interactions with the Board of Health members and the public, and know the Board of Health will continue to help protect Broadwater County citizens. Thank you for allowing me to serve on the Board of Health for the past several years.
Thanks, JJ.
Yeah, thank you. Thank you very much.
Yeah, and I'm willing to help with any issues if you guys need help.
Thank you.
Yeah, it's good. I know it doesn't always seem like it's DEQ focused or, sanitarian focused, but that does come up. I mean, it definitely, we get all things. So Next letter is from Dwight Thompson. He says, Dear Chairman Rick Meyer, board members, and County Health Board staff, after careful consideration, I have decided to resign from the Health Board. I've very much enjoyed being part of this board. The professionalism displayed from everyone that participates in this very important group is at the top. I feel very comfortable with the direction and enthusiasm this board is showing. After going through COVID and how it affected the county and how important this board is to have, proves the importance of all the work that goes into making and keeping up to date with all the issues. Thank you everyone for the pleasure and privilege to work alongside of you. I wish you all the best. Broadwater County is in the best of hands. Please reach out to me if you ever need anything, Dwight. I know. I'm really bummed. I'm bummed that we will be, I don't want to say losing, but you guys won't be a part of it. So thank you to everybody who's participated. It's a lot. It's extra. I'm on top of what everybody's got going on. So really, really appreciate it.
We need a motion, right?
Yeah, let's do a motion. And then you don't have to say your name. I'll say it when I recap. But
Okay.
do a motion, please, for, you can say all 3 members. You can just say their names.
All right, I'd like to make a motion to approve the resignation of Emily Clark, JJ Connor, and Dwight Thompson from the Board of Health, effective 12/25/25, or 12/31/25, sorry about that.
Okay.
I'll second.
All right. There's been a motion by Tiffany to approve letters of resignation, and a second by JJ Connor to approve letters of resignation for Emily Clark, JJ Connor, and Dwight Thompson. Is there any public comment? Any public comment? Okay, one more time, I'll just say thank you for everyone's time. Thank you, JJ. I know it's a lot to schedule around with work, so we really appreciate your input and for being a part of that and giving your time. All right, all those in favor, please signify by saying aye. Aye.
Aye.
All those opposed, same sign. Motion passes. Okay, next. All right, we have 2 letters of interest. I'm just going to read them both. We can do these separately. I do have down here, though. I wrote down terms. That's important as we do these. First letter of interest is from Alyssa Lawrence, and she is at Billings Clinic. And she actually addressed this to you, which you passed on to us. Thank you. I hope this message finds you well. I'm writing to express my interest in joining the Board of Health and role of Infection Prevention RN. With my background in acute care and ER and my commitment to promoting safe, evidence-based practices, I am eager to contribute to initiatives that enhance community health and infection control standards. Please let me know the next steps or any additional information you may need from me. I look forward to the opportunity to collaborate and support the board's mission. Thank you for your time and consideration. So Alyssa would be finishing Emily's term, which expires in a year, December. So this would be to complete that term, or we could say a term expiring on 12/31/26. Please include that in the motion.
All right, I'd like to make a motion to accept Alyssa Lawrence's proposal to finish Emily's term, finishing 12/31/26.
I'll second.
Okay, there's been a motion by Tiffany and a second by JJ to approve the letter of interest, from Alyssa Lawrence to finish Emily Clark's term that expires on 12/31/26. Is there any public comment? Any public comment? Okay, hearing none. All those in favor, please signify by saying aye.
Aye.
Aye. All those opposed, same sign. Motion passes. All right. right, the next letter of interest is from a gentleman named David Bug. I've talked with David a little bit. He did send in a very thorough resume, has a background in various parts of healthcare. He's military and has done quite a thorough background, a lot of different things, including midwife, just a lot of different stuff. Again, military. David's letter says, "Good to talk with you." Let's see. While reading the Three Forks newspaper, I saw that the legal section had an announcement which listed openings for volunteers to fill positions on various Broadwater County boards. I'd be interested in volunteering my service to one of the listed boards. My preferences of board choice in order, and the first one was Board of Health, so that's the one we'll focus on. This is his first choice if selected. He attaches resume details, his retirement from a rural two-county public health district that services a large geographical rural area in central Washington state. He has a thorough and working knowledge of how Board of Health functions, its oversight role, and the issues which are unique to such rural areas. Issues of funding sources versus budget versus service functions are something known within his experience. And he offers to be contacted and would like to be of service if possible. And this would be a 3-year term for David. Okay.
Madam Chair, I'll make a recommendation.
Please.
That David Bugs be accepted to the Board of Health for a 3-year term.
Okay. Is there a second?
I'll second.
Okay. Okay, there's been a motion by JJ and a second by Tiffany to recommend David Bug for a 3-year term on the Board of Health. Is there any public comment? Any public comment? Hearing none?
Excuse me?
Oh, yes, please.
I didn't hear much of what you said. What's this person's name?
His name is David Bug, and I believe he's newer to the community. He has served on a previous Board of Health in Washington and has various healthcare experience. Okay. And I think he's
in Three Forks.
And he's in Three Forks, thank you, yeah. And it's always good, I really appreciate when we have new people, especially people new to the community, wanting to get involved and help out. I think that's great. Okay, is there any public comment? None? Okay. Hearing none, all those in favor, please signify by saying aye.
Aye.
All those opposed, same sign. Motion passes. All right. Daleen, would you be able to reach out to both of these individuals and let them know?
Yeah, I'll send them letters.
Thank you, ma'am. And then the commissioners will approve both of these, or they'll just, I shouldn't say will approve, they will discuss it and talk about that at the meeting on Wednesday. All right. Next up, Megan Bullock, Broadwater County Sanitarian, Environmental Health Department update. And I'm sorry, I feel bad making you talk because I know you're coughing a bit.
There were pages of activities, summary of activities in your packet. Things are going steady, staying busy. So if there were any that you had questions on.
Is it, how does it compare to last year? Just out of curiosity.
So it's hard to tell because our meetings were kind of off, and I like to compare. So I pivoted, and I'm doing monthly reports so that now I can compare month to month in the future. But I think it's about the same as it was last year. Right now we're working on a couple enforcement cases. Daleen and I are working on the silos. And the problem out there is that most of the parcels are approved for one single family dwelling. And if you've gone through there's many, many camper trailers that people live in. So,
is it people living in them?
Some of them have slide outs out. Some of them you can see water hooked to them. So I would assume that those are being lived in. My thought is to initially just put out just kind of a notice, letting them know that they're approved for one single-family dwelling. Just putting them on notice, basically, so that when the summer comes, if we see the same thing, then we can start enforcement.
So sorry, go ahead.
I was gonna say just mail it to each lot
Mm-hmm.
out there, or each lot that you saw issues with.
No, I think the initial letter will go to everybody.
Sounds good.
Yeah.
I
It's
know
a big
some-
task.
It's a huge task, and I don't know how many years ago, maybe 10, there were notices, like, I don't know if they were mailed or stuck
Yep.
to stuff out there to everyone. People got really upset.
Yeah.
So I'm not sure if, and because I think there's a lot of people just on there in the weekends, and I know like I know people who will have just people's campers parked there, but they're not using the septic, right? So I mean, is there or will there be a course of action for someone who's like, hey, my friends just park this here, they don't plug into the septic, they're just here? I mean, is there something that...
So in all honesty, if the trailer is self-contained and they have their own water, their own wastewater, they're dumping at an approved site, there's honestly not a lot we can do. Where you run into trouble is if they're offering for the general public to come, because if it's family, friends, that's going to be a tough one too. But if they're allowing people to come and stay there that aren't family, aren't friends, just hooking up, the hookups will be a big deal. If they're hooked to water and or sewer, that's a big violation. So it'll be tough to weed through all of them.
Is there, I don't know, that's hard. I wish there was like a course of action so we don't just get, I know, man, people got riled.
Yeah.
And
Really, really
it's almost
upset.
like you would have to get evidence of it, but then they accuse you of taking pictures and giving evidence.
Right.
Yeah, it'll be a tough one. So legally, if they've got 2 or more spaces available to the public, then they are supposed to have a trailer court license, a campground license. So lots of ifs in there, and being self-contained, if they're truly self-contained, probably not a whole lot we can do about it.
Yes.
So
Will
the
that go
water.
to the whole county instead of one specific area of the county, or are you just going specific?
So 9 out of 10 times when people go through DEQ review, they're approved for one single-family dwelling. Now, there are exceptions. People do come in and they ask for 2 single-family or multiple, and if that's what they applied for and were approved, then they can have that. Those ones out there, I think we found 2, maybe 2 lots in the whole thing that went back through the review and got approved for more than one single-family dwelling. All the rest are single-family.
Yeah, I guess, I'm just curious. I'm just curious, is there a way to do it without people getting super upset? That's like, hey, FYI, here's the deal. You know,
That's how I plan to
we're
do
not-
it, is the very first letter that goes out is just not really putting them on notice, but just letting them know, because some people may not realize
Yeah.
that they're only approved for one single-family dwelling. So it's more of a FYI. And the habitual offenders, then I'll just have to deal with them one by one.
yeah, it's
for the
like,
rest
hey,
of my life.
here's the deal, everyone, just FYI, and then is there a plan to come through again and kind of check back? I mean, can you
Yeah,
tell
so
who's
I would
hooked up?
like to do the letter, the initial letter, January, February, ahead of the busy season. Just letting them know that, hey, you're only supposed to have one single-family dwelling.
And I guess to go back through review, what's that cost to go back through DEQ
Well,
review?
it's more complicated because some of those lots, the west side, there's just factors that have been proven through DEQ that limit the ability to put extra lots on, hydraulic connectivity and stuff on some of those. And some of the lots are super small. With the new rules, you can't have your mixing zone, not well isolation. It just depends. If it's a 2, 3, 4 acre lot, then maybe something can happen. But a lot of those are 1, 2 acre lots that wouldn't likely. I'd say 3/4 of them, probably half to 3/4 might be really difficult to do that.
And then it puts us back to what were the conditions of approval when they went through subdivision. And it likely is that it was one single-family dwelling.
Yep, so
So
subdivisions
that takes
would-
us back to our
Oh.
conundrum a few months ago,
Mm-hmm.
where they may have to go back through the whole subdivision process.
Okay. I'm just wondering if there's, hey, if you have questions, give me a call. Like, I don't know. I don't know what the right thing to say
Yeah,
is.
so I think an informational letter is probably best to start with. And then at least they know what the rules are and what they can and can't do.
Yeah. Okay.
It's a tough thing to do, because, I mean, a lot of them are self-contained, but they just dump in the drain field right on the lot they're in when they need
Yeah.
to hook up. So, I mean, it's like a he said, she said thing potentially.
You can't really, it's hard to enforce, right?
Mm-hmm.
I don't, and forgive my ignorance, but what are the consequences? I mean, it should seem fairly obvious.
Well-
Should more people be using a septic than it's approved for, then what happens?
The main consequence is that if they are overloading the septic, it wasn't built to handle that additional wastewater, then it could have premature failure.
Which is really good to put in the
And
letter,
then
right?
the water, we all know about that. You
Yeah.
know, if they were approved for just one single-family dwelling and they've got multiple people hooked to the water, that's a whole other issue.
It's good, I think it's good to point out, honestly, the consequences of because I think it's like you said, the people are using it, they're not, I'll just dump or whatever, but hey, this is what will happen.
And it's a violation of the COSA, the DEQ Certificate of Subdivision Approval. It's not really per se a violation of Broadwater County rules, but it's a violation of their DEQ approval.
I was going to say that's like an option. It'd be kind of something you guys would want to think about, but you can file complaints at DEQ.
Did
They have an
Broadwater,
enforcement section that would follow up on that.
Mm-hmm.
Yeah.
They could be the bad guy.
did Broadwater
opposed to the
County
county.
approve the second dwelling with the limited housing? I know, like Helena, did they approve
The
a second?
ADUs?
Yep.
Yep.
That
It's not-
only applied to counties that had zoning,
Okay.
and Broadwater County
It was-
doesn't
okay.
have zoning.
It
And so
has
they
to.
opted not to.
And even if the water for the subdivision wasn't an issue, there's issue with just the amount of houses out there and nitrate loading and the fact you probably can't
Yeah.
easily pass something in the future. I've done a couple out there, and it's just, before the water and the other issues came up, it's really difficult there's too much cumulative nitrates, too many drain fields, and you can't pass some of them in certain places.
And the proximity to surface water.
Yep.
It would be, that's important. I think that people need to understand it's not just people being, I want to regulate you, right?
Yeah.
I want to catch you doing something wrong. It's, here's the consequences. And, your proximity to surface water, things like this is what is affected. And that it's a DEQ or COSA violation. I don't know that, we don't want to be in the business of hardcore enforcement. So like you're saying, DEQs, complaints can be reported to DEQ, and I don't know what the penalty is from DEQ. What did they do?
They'll work with them to try to bring them into compliance, and if compliance is quit doing what they're doing, then it would go away. But the point is DEQ set up with their enforcement section to manage that and call people and make sure it's taken care of, where Megan's one person.
Right, and then, I'm sure the Board of Health would be able to, I shouldn't say I'm sure, but I think that there seems to be a lot we can do as a board regarding policies about that kind of stuff. But again, we don't have an enforcement
Right, if
arm,
you
so
don't.
it's like, are we going to issue fines? I don't know would that be a county? We'd have to make a policy that's this much of a fine.
I mean,
right?
DEQ isn't gonna, if you're worried about, DEQ's not gonna issue fines
Right.
initially. If the people blow them off, then potentially down the road, but they're gonna work with them to bring them in compliance unless the person isn't working with DEQ. Then they have the authority to take it a step further. But most of the time with enforcement on stuff where we've worked on different sites, they are very patient. And the difference is they will call them frequently and bug them until it's taken care of.
Okay.
Or make them give data and written statements verifying that it's an enclosed unit or whatever the case.
Do you think you would have a draft of this letter by the January meeting?
I can.
Okay.
Yep.
I think that'd be good, and then we could, I mean, I think it would be helpful to maybe have input, not saying that you will not do a fantastic job on it, but it's.
Daleen right now is putting all the information in a spreadsheet, and from there we will actually go drive every single and just note what we see to get an idea of what we're dealing with. Kind of what triggered it is I had a complaint out there, and so I went to look at it, and I had a hard time sending those people a notice of violation when you can turn around and see 5 other lots doing
Sure.
the exact same thing. So
Sure.
I think the best way to start is just by sending everybody a letter.
Yeah, and I agree with you. I think a general FYI letter is good. It would not, if, hey, here's how this works. Like, complaints go to DEQ. DEQ will work with you to come into compliance. I mean, or something along those lines. And then, I don't know, maybe the Board of Health needs to look at what it is able to do, find ways. And the only thing, I don't want to find people, I don't want to be out regulating and enforcing things. However, if there is an issue of like public sanitation and
Right.
problems there, then maybe we need to look into it and step further. That's all.
I'll draft something and have it by the next
Thank
meeting.
you. That would be great.
And I think that's where the DEQ, if they reach out, they can ask Megan, hey, could you go see if this person removed their trailers? That's where they might ask for help in the past, so that might be useful to put the heat on the DEQ who's set
Yeah.
up to do it as opposed to you guys.
And it's not limited to the silos by any means. When I'm out driving around, I see lots of camper trailers
Yeah.
that appear to be being lived in, so.
Well, and it's so hard, but just with housing the way it is, the shortage
It
of
is,
housing,
I get
all of
it.
it, it's so
Yeah.
hard. Yeah. It's, all right. Thank you, Megan. Oh, I'm sorry. Did anybody else have questions on her stuff? Okay.
That sounds like a good plan.
Yeah. All right. Ruby Taylor, Public Health Director. We're going to get a department update from you, and then we'll roll you right into some planning stuff. Exciting, I know. All right.
Overall department update. We've got nothing crazy going on right now. We just had our first flu case come in today, so get ready for flu season. It'll be fun. And then COVID's about the same. There's really not a bunch going on. We've done a ton of COVID vaccines and a ton of flu vaccines, and then I'm just working on my typical grant stuff and nothing too crazy. Oh, yes. Sorry. Thank you. We had 2 cases of measles in the county. They are on like the super south end of the county. Like if they step out of their backyard, they're now in Gallatin County. So all of the exposure risk to the public is in Gallatin County. But since they are Broadwater County residents, they show up on the measles map for the state as Broadwater County cases. So FYI, and as of last Monday, they were out of their contagious period. They're off quarantine, both doing well, nothing crazy. But technically, those are our measles.
Those are our measles. That's
Yes.
great.
Yeah.
However, they are mostly Gallatins. So
Did you guys put up any public notices at Public Health about measles outbreak in the county?
we put a post on our Facebook page about it, and I was going to have an article in the paper this week, but I missed the deadline, so hopefully for next week. And with our notice on our Facebook page, we put an infographic from the state about measles prevention, precautions, and just what to look for and how to treat it if you feel you might have that concern. So,
Are cases of measles rising nationally?
mostly, as far as I know, nationally, there hasn't been like a huge influx, but since Thanksgiving in Montana, we have had a resurgence.
I feel like they peaked about 2 months ago with the number of measles cases we were seeing.
Yeah, and then we had a few come up
The
over the
travel.
Thanksgiving break. So, and most of those were, I think, Kalispell and Gallatin.
If your child is vaccinated for MMR, right, and for measles, can you still get measles?
Potentially, yes. However, the vaccination does cause, like, if you get measles, it's less severe. So it is still a good idea to vaccinate. And the biggest part of measles vaccination for, like, school-age children is that if you are exposed to measles and unvaccinated, it's 21 days of isolation. And so you will not be able to go to school for those. I think it's 21 to 30, if I'm not mistaken. I would have to double check, but it's a long time. And so to miss that much school is rough on a kid. And it's just safer to be vaccinated and safe rather than sorry on that front, for sure.
Does that mean like the parents have to be isolated too because they're interacting?
It would
with the
depend on
kid?
if the parent's vaccination status. Because a lot of parents are already vaccinated because we didn't have as much anti-vax rhetoric when most of us were kids. So most of us are vaccinated
I mean, how long has the measles vaccination been around?
forever and a day.
A long
I think the
time.
60s is maybe when it came out.
Yeah, and then you get titered when you're pregnant too. So most women have been titered.
Huh.
It's a super effective vaccine, unlike some of the other vaccines. If you've had MMR, more than likely you have a titer, and that will last you years, if not a lifetime.
Interesting. If people need information on vaccine schedules or recommended schedules,
They can call us.
that you guys have that. Okay.
And we're more than happy to work with parents and individuals on like modified scheduling. So if you're not comfortable getting
I was just going to ask that.
vaccinations done all at once or as the recommended schedule is, then we are more than happy to figure something out with you to make it so that you come in. We've even done like once every 2 weeks for some kiddos. So we are very much accommodating, and we are not going to push you to do anything you're overly uncomfortable with. But we do want to have your children vaccinated, so we are happy to work with you.
Awesome. Thank you, ma'am. Any other?
Not that I can think of.
additions?
Nothing too crazy.
Okay.
It's pretty much business as usual around the health department.
Okay. Doc, did you want to say anything about, kind of tag on to Ruby's update on the health department? Did you have anything to say?
Other than, Ruby, I don't know how many people are getting the shingles vaccination.
Doc, can you come up?
they
Sorry,
can hear
I'm
you on
sorry.
the
You got to come up to
microphone.
the, I know it's a pain. I appreciate you.
This is a chore.
Yeah, I know.
I just don't know how many people I sent over to get the shingles vaccinations. Really,
We have quite a few.
they come in and
yep.
get them. Yeah.
Yep, there's very few that we've had come in and not get them or
Oh, okay.
just no show us.
And
A lot
they
of
show up
people.
for the second one.
Yep.
Good.
Yep,
Good. That's the only thing I was concerned about.
Okay.
we're getting them.
Good, good.
Thank you. Do you have anything else you want to add?
No, everything's fine.
Okay. It's all fine. It's good. Thank you, sir.
Yeah.
Have you noticed an influx in norovirus or RSV coming to county? Because the hospital's seeing a lot.
I haven't noticed it necessarily, but Jenna does most of my case investigations, so she maybe has noticed more than I have.
Okay. Just to keep on your awareness.
Yeah, we'll keep an eye on it for sure. We haven't had a ton of people come in for RSV vaccines this year.
Interesting. Okay.
But my understanding of the RSV vaccine is that it was a one and done, and we did a ton for adults last year. So that would explain why we don't have a whole ton coming in this year. But
Yeah.
and we don't, we have the VFC RSV, but I don't think we carry it in private stock. Not that we couldn't get it, we just haven't had people ask for it. So we keep the one for adults because that's the one we get the most questioning on.
Bless you.
Bless you. Okay. Thank you. Any other questions for Ruby?
No.
Okay. You might as well stay there.
All right, back.
Yeah,
Hello
thank
again.
you. Next up was discussion decision, 2026 planning. And you're first up here, Ruby, talking about the public health emergency plans. And I know we wanted to start on those. We had just talked about maybe taking one piece,
Yes.
the emergency plans, to start reviewing. I think we'll kick that to January.
Thank goodness.
Yep.
I think that was kind of our broad plan anyway, was to start bringing them in January so that we could get them all updated for my grants for the year at that point. So
What is that going to look like for us? Because I know it'll take some time. I mean, we'll have a new board. I mean, some new members on the board, and then what do we need to be looking at? Like, how much time? I mean, you see something in one meeting, right? It takes a long time. You want to see it ahead of time.
yes, I will send it before whatever plans I have ready for us next month. I will make sure I get out to you guys.
Okay.
I know for sure like my chem transport plan is ready, and then I can probably get another one or two done. And my most of those plans are pretty brief, and they just require someone else to look at them and be like, yes, this would be functional if we ever needed to deploy it. So it's nothing too crazy. I would say, unless there's like huge issues with any of the plans, it shouldn't take us more than like 15-20 minutes to discuss and
Okay.
get everything signed and make sure we're all good.
Okay. Will that be something that needs to go through, like, first our board, then through the commissioners?
It shouldn't have to go through the commission,
Okay.
because I don't plan on completely revamping everything.
Okay.
I'm going to take the plans that we have and just kind of make sure they're still applicable. There's only a couple that I'm like, yeah, I'll probably have to redo that. But for the most part, I think I can keep them mostly similar.
Okay. So for January, if you just let us know, and for the agenda, and I would say let Daily know what plan we're working on, or two plans, if you think we need to do two. And we're going to have some housekeeping that first month.
Yeah.
And I'm honestly kind of like, if we need to meet on a monthly basis to get through stuff, we should, because as we've seen, it's every other month is difficult, but then it kind of gets behind, right?
Yeah.
And we're trying to play catch up. So
Yeah.
just a thought. So yeah, if you can let Daily know, and then we can get on the agenda the right way.
Yes.
Send out. Okay. All right. I would say the same thing for the Board of Health strategic plan. We were all discussing item number 1. I think you can probably sit down.
I don't care.
Okay.
If you want me
You don't
here,
have
I'll
to
be
stand
here.
up here. We were looking at that strategic plan, public health policy development. Kind of goes hand in hand with what we'll be doing with her. So we'll push that to January. And I guess for the January meeting, and that's number 1 on our plan here, we can make sure we get this information sent to new members. I'm going to just make a note of that. Did you just sneeze?
Yes.
Oh, bless you. Okay. Okay. And so we have one other little, well, actually, no, I'll talk about that in a minute. But yeah, if we can just, we'll just get the info to the new members, and we can kind of talk about the public health and policy development in conjunction with Ruby's deal.
That sounds good.
Thank you. Next on the list was funding programs. I've printed some stuff off that I looked into. There were a couple things, and we had them on the agenda previously. There's that 330A Public Health Service Act that was talking about outreach grant program, some rural network development programs, but I'd like to put that on the agenda for January. I don't think right now is the best time, and we'll look at that. as well as there was also previously sent out, and I can send this again, and I'll just make a note to send this to everybody, these rural community programs that also have grant funding. But I think, we'd have to have an idea of what we're using that funding for, right? Like what we want to do. And there are options for boards of health. I know it doesn't have to be super active, but it kind of tends to be a little more efficient when everybody's a little more, even minorly active. So we'll do this. And I think that that's something, funding and stuff isn't, I would say that's not quite as big of a priority because we would need to figure out what we need funding for.
Yeah.
Okay. Sorry, I have to take good notes, or by the time we get together again, I'll have forgotten half the stuff. So I'll add in here real quick. We've got JJ, you're going to be gone. Dwight's going to be gone. We just approved 2 new members, so we'll have 3 members. I'm technically not supposed to be on the board at this point. So what will probably happen, I think, is we do not want 4 members. That's never good.
Yeah.
So we'll probably do a 3-member board unless we can find 2 new members, 2 new people to recruit. So I would ask everybody to please talk to like 1 or 2 people that you think would be good additions to this board. And they don't have to have this long depth, of experience in healthcare. It's okay. But just people that would be good and beneficial. And I think some average people from the community that don't maybe have healthcare are good because they bring in a different perspective. But we will start January with a 3-member board, and I will move to be a commission liaison, which is really what the commissioners are for the other boards. So, that will be the plan because we don't want 4.
No.
You look really excited. All right. See how excited she looks? She looks she's just going to start cheering.
I know where this is going.
You do? No, you know. That's all right. It'll be good. We've got a plan. You guys are on board. We know kind of where we're going. It's just going to take a little education and we'll get everybody caught up. All right, next up, discussion decision. County website, Board of Health. So this was something that's carried over for about 4 meetings now. Updates, new information. It's pretty plain right now. There's not a lot of information on there. It says, who the board members are.
Yeah.
I guess, what do we want to see on the website? We can't go crazy. We can add pictures. We can add links to things. We can add documents. What would you guys like to see as a study thing on there? And then I know we discussed maybe seasonal updates as well.
I was thinking about it, we would have put our, or I would have emailed you guys, the measles update on the Board of Health website would have been a good one. It's on our website, on Public Health's website, but
That'd be good for
we could ask Ken to put it over there too.
I can do it. It's easy.
Okay, I'll send it to you.
Yeah, Daylene and I both have skills. Daylene's like, nope, don't volunteer me. But yeah, we both are able to do that and put stuff on there. I think just updates like that. Did we want to add some information?
There's a link to county health on the website also, right on
Yeah.
ours. So that way, for vaccines, information, things like that. We talked about some seasonal stuff. It'd be really nice this time of year if there's any place for people to go to get warm, or if they have needs, things like that would be good.
Okay. Because right now, because JJ's leaving us, no guilt. So I wonder if that's, do you and I want to just work on, pulling out of my chart.
I'll try and send you some links when I have some
Okay.
second to breathe.
Ruby, do you have anything, or Megan, what would you guys like to see? I think we have, I need to check.
I
To
think
public
there is
health.
a link to public health on there.
And environmental health too, I believe. But is there anything you would like to put on there? I mean, I think you're linking, like you said, measles. Anything else you think it would be important for the board to have? And come up here. Sorry. I know.
See, I should have just stood here. Not that I can think of off the top of my head, other than like countywide updates type of things, because I think that it's good to put that sort of thing in multiple places, just so that if someone doesn't see it on our website or on the Facebook page, that it does show up somewhere in their radar. So if I was thinking, I would have had Ken put it on the Board of Health one, but I did not think that last week, because this all kind of came flying at me Monday, and we had to have an answer by Tuesday morning. So it was a good time. But we can get that going, and then maybe when we get plans updated and everything, we can add those to it too, like our emergency preparedness plans or anything like that, or we can put those on ours and just have a link to it on the Board of Health page.
New laws and stuff should probably go
Yes.
there too. Like there's a new car seat law we could put on the website.
Yeah.
It's a big change for people.
New laws. Okay.
For safety.
Is there anything from the environmental health side that you guys think would be good to have maybe on Board of Health? That would be, it could link to your stuff, or like that people could get information, kind of like we were talking about.
Like single family dwellings.
Yes,
like
single family
not overloading
dwellings. Any
systems.
letters that might go out that you would put out, we could put those letters on, on the web page as well.
We could maybe do an info sheet or infographic on single family dwellings for the county, just FYI.
Maybe information where to get septic permits, things like that. Okay.
Maybe even like an explanation that, if you want to add additional residences, you need to contact the county for questions.
Yes.
Something just innocuous like that.
Mm-hmm.
Maybe like a list of information that like a public member, like a community member, wanted to bring to Board of Health, like what would be appropriate to bring to Board of Health too?
Yeah, like an FAQ.
Yeah.
Like, what does the Board of Health do? What is what are we governed by?
Mm-hmm.
What is within our scope? Okay. 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 I like that idea. Let's start with that.
Okay.
I think the agenda, we were talking about, again, seasonal updates, but we kind of get that through Ruby's stuff. I don't know that we need to do a whole lot more on the agenda. Is there anything anyone would like to see on the agenda on a regular basis that we are not addressing? Nothing? Doc, anything you wanted us to add? No?
Nope, not right now.
Okay. All right. All right, well, that is just about everything. Again, next meeting, January 19th, 3 p.m. The next agenda, we will be looking at just a bylaws review, so that will get sent out. And I think I'll help Daleen with kind of like a packet of information for our new members so they can get caught up. And then election of officers. Sorry in advance. And then just meeting frequency. And I'm a fan of, I would rather say we meet monthly and we cancel if we don't need it.
Yeah.
Than to say we meet every other. That's my suggestion and my
That would
2 cents.
be easier, like in my case and maybe others, if you had a consistent schedule that you could
Yes.
plan ahead for. And then if it got canceled, so be it.
That's what I think.
But if you knew what dates they were and could plan them ahead on your schedule, then more people might be able to
Yeah.
plan around.
And I think, I mean, I think our time seems to work pretty well, but we can check with our new members as well. So, just so I have it in my head, we've got new packet information with our strategic planning, whatnot, kind of maybe the minutes that we will get out to the new members when Daleen sends them letters.
Do you have your community needs assessment accessible yet?
Oh, yeah.
I have it somewhere in my office, yes.
It'd be nice to see what the
I would
community needs
agree.
are for Board of Health.
Yeah.
It'd help us find some focus, I think.
Yes,
I'll bring
please.
that on.
I mean, I have the hospital one, but I think it'd be better if it came from public health.
I agree. Thank you. I'm so glad you said that because I forgot about that. Okay. All right. Is there anything else anyone wants to add? Don't everybody talk at once. All right. Thank you for your time, JJ. Thank you again. We'll miss having you.
It was a pleasure.
Okay. All right. Thank you. We will adjourn. I think I got everything right.
I think so.
She was like, I don't know.